Psychoactive drugs are substances that act on the nervous system to alter states of consciousness, modify perceptions, or change moods. Drug use for personal gratification can be dangerous because it can lead to drug dependency, personality disarray, and a predisposition towards serious, sometimes fatal diseases. Continued use of psychoactive drugs leads to tolerance, the need to take an increasing amount of a drug to get the same effect. Continued use can also result in physical dependence or the physiological need for a specific drug. Without that drug, the person exhibits withdrawal symptoms. Psychological dependence is a strong desire to repeat the use of a particular drug for emotional reasons. For drug use to be considered an addiction, there has to be a physical or psychological dependence on the drug. Psychoactive drugs cause an increase in dopamine levels in the brain's reward system pathways, especially in the ventral tegmental area and the nucleus accumbens, the center of the brain implicated in pleasure. There are three classifications of psychoactive drugs: depressants, stimulants, and hallucinogens. Depressants slow down mental and physical activity. Alcohol, barbiturates, tranquilizers, and opiates are the most widely used depressant drug. Stimulants work by increasing the level of activity in the central nervous system. The most widely used stimulants are caffeine, nicotine, amphetamines, and cocaine. Hallucinogens modify a person's perceptual experience and produce visual images or auditory hallucinations that are not real. Thank you for watching, and in the next video, we will discuss health psychology.